The advantage that we have here in our community with VCU, CMH, Emergency Department and Hospital is that we are able to treat patients with an acute stroke. We have the ability to provide thrombolytic care in a timely and expertly managed fashion. Bringing a patient to our community hospital is essentially the same as bringing a patient to the emergency department in Richmond. We transfer very few stroke patients to Richmond, and when we do, there's always a specific reason that we cannot manage those patients here. Very, very few.
We've been doing TPA here since 2000, 2001. There is no other community hospital of this size that has been doing the same thing for that length of time.
We meet the standards for the Joint Commission Disease-Specific Primary Stroke Center. We're awarded Gold Star Plus through the American Heart American Stroke Association for their target stroke. The guidelines that we follow are from the American Heart American Stroke Guidelines, and that's what we follow to be able to be certified as a primary stroke center. Part of those guidelines is very specific time frames. From the time the patient hits the door, we start the clock.
Time is brain, and the sooner we treat those patients, the better they do as an outcome.
Patients are presented to our emergency department via the EMS system. They're met by our nursing team. A very rapid assessment is done at that time by the nursing team in terms of, is the patient having a stroke, and do they meet criteria for that patient to have expedited testing and CT scanning. Either a physician or a nurse practitioner is also involved in that decision making. They are then taken directly and immediately over to our CT scanner, where the scan is done and reported within just several minutes to the physician or nurse practitioner.
The target goal that most studies show is under 60 minutes. We want to make sure we meet that benchmark of from the time you come in the door to the time we get the medicine to you in under 60 minutes. Every minute counts. That's why it's so important for EMS to bring the patients in if they can. They can start IVs. They can draw the blood. They can check the blood sugar. They can call in the report to us, and we can pre-register the patient, get them to the CT faster, and get them treated faster.
Time is the essence of the problem. And the best way to come to the hospital when you have a stroke is to call 911.
I had a gentleman, he's sitting at the kitchen table with his brother. He dropped his coffee cup. His brother noticed it and picked it up and he dropped it again. His brother called 911. We got him within 30 minutes of his symptoms starting. We got TPA to him in another 35 minutes. He walked out of the hospital perfectly fine 3 days later. When he came to us, he couldn't move anything on his left side and he couldn't talk.
Great job.
So if he had not come in, the man's life would have been totally different.
We have the expertise, we have the technology, but more importantly, because we do it well, you have more chances to recover.
By far, the best outcome would be to bring the patients directly to the emergency department at VCU CMH. There is no doubt that that would be the appropriate care to deliver to the patients in our community.